Welcome to ModPath Chat, the official podcast of modern pathology, featuring interviews with authors and experts on the latest science, technology, and developments in the field of pathology. Your host, Dr. George Netto, is the editor-in-chief of Modern Pathology and the chair of pathology at the University of Alabama at Birmingham. Here's Dr. Netto.
Welcome to ModPath Chat. It's my great pleasure today to host Dr. Claudio Luchini, Associate Professor of Pathology at Verona University in Italy. Claudio's main research focus is pancreatic and molecular pathology. He's here today on behalf of a large group of eminent co-authors to discuss his recent published review in Modern Pathology. The review is on the assessment of Ki-67 in neuroendocrine neoplasms, specifically in pancreatic neuroendocrine neoplasm, and comparing manual versus digital, which is the best method for the future. Thank you, Claudio, for accepting my invitation.
Thank you very much, Dr. Netto. For me, it's a big honor being here today. So this study started from our improvement in the knowledge that artificial intelligence-based systems are concretely reshaping our lives. And this function is also true for oncology and related areas, starting with pathology, where artificial intelligence-based systems are opening new important opportunities, new horizons for improving ultimately the management of cancer patients. Our specific investigation regarded a very critical task for pathologists during the routine diagnostic activity of neuroendocrine neoplasms, which is represented by Ki-67 assessment. It is a very important step, not only for simple tumor grading, but also for treatment selection. Mm-hmm. We take into account our main area of interest, which is represented by pancreatic tumors.
Let me interject here. So what you're saying is the Ki-67 assessment in general and neuroendocrine neoplasm, regardless of location, is becoming part of the prognostics and actually the diagnostic workup. But this current study, and the reason I wanted to interject here is mention that I mentioned a large group of co-authors that you're presenting. Including Lyron Pantanowitz and Aldo Scarpa, among others. So the authors really reflect a lot of neuroendocrine tumors, not just pancreas, but this specific focus is on pancreas. So tell me why, I know your interest is in pancreas, but why did you feel inclined as a group to put this review to evaluate pancreatic NEN assessment of proliferation index?
Well, with Aldo Scarpa, we decided to perform this study. But we know that for finalizing a study like this, for improving the discussion and the interpretation of the results towards something of very significant, one of the most important steps is represented by have experts, a panel of experts in the field, and to have an active discussion. We really have many emails among all the co-authors with personal experiences and also critical comments, and then based also on the long-standing experience of Aldo, but other authors like Lyron Pantanowitz, Silvia Asa, Volkan Adsey, and then many others. We have this study which aims at summarizing all the knowledge, and not only this specific task. Something that can be useful also for other neoplasms.
Excellent. So it's a mixture of a meta-analysis of we're gonna talk about that of the literature, but in the same time, I'm glad to hear that there was some expert opinion also, consensus, if you will, on that. So that will make it a very helpful paper, and like you said, to emulate probably in other neuroendocrine neoplasms. So how many studies did you review and include in your meta-analysis?
Yes, so we found 22 eligible studies for the systematic review and 4 specific for the meta-analysis. And we review a total of 752 patients with pancreatic neuroendocrine neoplasms.
So that's a large number. And what... And these, so your focus was comparing these studies included some with manual assessment versus digital, or all studies had both?
No, for the comparative meta-analysis, we selected specifically those studies that presented such both data of manual and digital pathology-based system. But for the first part was represented by a systematic review of all published experience on this topic. And we extracted from all studies advantages and both advantages and drawbacks and limitations for these 2 types of approaches.
So briefly, let's touch, this is a very important point. What's the advantages of one approach versus the other and disadvantages? Let's do that briefly.
Yes. Right now, the WHO classification specifies that a Ki-67 assessment should be performed by manual counting right now, 2017-2019 edition, on a printed image, including at least 500 of neoplastic cells from the regions of highest labeling, the so-called hotspot. But this task appears a little bit long and not very reliable, with some issues that have been encountered in different laboratories and so on. So from the systematic review, we found that digital pathology-based systems have key advantages in giving an improved reproducibility and reliability, and also a reduced time required for this specific task, which is very important. Above all, I think the reproducibility and the reliability are a very important index of a good work. And at the same time, we found also important limitations for digital pathology, but it is very important to know to acknowledge the limitation for improving this kind of approach, which really represents the future in this field. So we found that.
So what are these disadvantages? Sorry, I interrupted you.
Sorry. No, the most important advantages, the most important limitations regarding digital pathology-based systems were higher costs, a general lack of widespread availability, depending on the place, on the type of hospital, on the possibility of the health system and so on. Some issues related to operator qualification and training issues, above all, if this task is not done by pathologists, but by technicians and so on. And the drawback of image algorithms contaminating non-neoplastic cells And this is very important, as for example, lymphocytes, endothelial cells, but also other signals like hemosiderin. So, all these limitations represent a very critical point. But now we have to acknowledge that many systems, many published experience on this topic have already demonstrated that these kind of issues can be overcome thanks to a central role of pathologists in guiding this action.
Excellent. So there is a possibility to circumvent these challenges, and actually some of these challenges, even for us, when we're trying to count those the positive cells, lymphocytes, for example, and endothelial, you're absolutely correct. It's not always easy to discount those. So hopefully the computer and maybe multicolor and what have you can help with that. So taking it forward, you think the next edition of WHO will include at least digital as another option? I know they're limited by the fact that WHO classification is for the worldwide, and not every, you mentioned the resources, the inequity of resources. It could be difficult if they mandate digital. So I imagine that's not going to happen anytime soon. But it will be, you expect based on this study and future studies that digital may become another option for standard of care?
Oh yes, for sure. I expect this. I think there is an important future for the adoption of digital pathology in routine diagnostic activity, for improving, as I have already said, reproducibility, reliability, but above all, the general quality towards better management of patients. We show very clearly with the comparative meta-analysis that there is a very high concordance between the two modalities, manual and digital counting of Ki-67. So, there is an equivalence, but the advantages brought by the use of systems based on digital pathology are very clear, and I think this study highlights very well the importance of moving towards the adoption of this kind of systems.
And my final question, you think if we not just, I know you mentioned next could be organs like breast, brain, hematolymphoid, if we start doing it digitally, is there data at least to show that when you classify based on digital, it correlates better with outcome and to refine management, or is it just a matter of equivalency making our life easy? Because that's also important, right?
Yes, so the real target is to modify the treatment, to improving the treatment, not only to have a correct grading, right. And the use of, as we also show in this study, the use of digitalized based systems is really along this line. Above all, for example, in this specific area, in the gray areas of transition between G1 and G2, and G2 and G3, and also for small biopsy or in cell blocks, all these areas are, difficult for the assessment, for a correct assessment of Ki-67. So, generally speaking, I think that there are important opportunities opened by digital pathology in this kind of task. And an important point is that we show this in pancreatic neuroendocrine neoplasms, but you can take this lesson and put on other organs like breast, hematopathology, and other kind of tumors.
Excellent. So I guess I thought it was my last question, but I have another question. So currently, what are the cutoffs between G1, G2, G2, G3? And would the same cutoffs using the digital system be used? Is it a percentage? And can you share for those of us who don't do neuroendocrine pancreas neoplasm every day?
Yes, it is possible that accumulating evidences in the next year, also this kind of gray areas and may be refined. So I think we have to apply, we have to use such systems and see what happens. I think that there is a brilliant future for this kind of technologies.
Excellent. So more studies to come. I really appreciate your time. This is the kind of exciting studies that we always are happy to be part of in Modern Path. And for our audience, this is an open source article. So you can read it with more details anytime. So it's been a pleasure to have you as my guest, Claudio.
And,
thank you. And again, for our listeners, please visit us at our USCAP YouTube channel and Twitter handle at Modern Pathology. As I mentioned before, now the podcast can be seen in a video format at the USCAP YouTube channel. And by the way, Claudio, this is our 50th episode. So it's a milestone. So it was so nice to have you, and so long, everyone.
Thank you very much. It was a big pleasure to meet you, and I hope to see in person in the next USCAP meeting.
Will be lovely. All right. Thank you.
Fantastic.
Any opinions expressed in this podcast are the speaker's own and do not represent the views of Modern Pathology, Springer Nature, UAB, or USCAP. Your ModPath Chat host and scientific director is Dr. George Netto. Producers are Christina Crow, Amber Jackson, Dr. Sarah Jang, and Dr. Catherine Ketchum. Technical direction is provided by Kaminsky Productions, music by Mitch Neubauer. Thanks to the authors, reviewers, and editors of Modern Pathology for making this podcast possible.